Ignoring a dangerous heart rate for a long time can lead to heart disease, stroke, or other heart problems. Heart rate is a measure of a person's health. When you go to the doctor first checks the heart rate with a stethoscope. Heartbeat is a measurement of the heart rate. Heart rate indicates how many times our heart beats per minute. It is not only a parameter of our heart health, but also indicates the fitness and stress level of our body. A normal heart rate is 60 to 100 beats per minute. If your heart rate is more than 100 or less than 60 per minute, it may be a sign of danger. A normal heart rate means that your heart is pumping blood properly, but a dangerous heart rate can be a sign of a serious problem. The heart rate at rest is called the resting heart rate. The heart rate during an active state is called the active heart rate, both of which have different normal and dangerous ranges. Heart rate is affected by many factors such as age, health condition, exercise, medications, and stress. Maintaining a normal heart rate range is important for a healthy heart, but ignoring a dangerous heart rate for a long time can lead to heart disease, stroke, or other heart problems. Therefore, it is important to monitor your heart rate and consult a doctor in time if any abnormality is found. What is an abnormal heart rate? An abnormal heart rate falls into the category of dangerous heart rates. This problem has the potential to increase the risk of heart attack or stroke. There are two types of abnormal heart rates. One is a very fast heart rate, tachycardia. The other is a slow or irregular heart rate, bradycardia. If there are more than 100 beats per minute, it is called tachycardia. If there are less than 60 beats per hour, it is called bradycardia. In both cases, the heart has difficulty pumping enough blood. Although premature heart rates are sometimes not harmful, they disrupt the supply of oxygen to other organs, including the heart. Angina is a condition in which the heart does not receive enough oxygenated blood. This causes chest pain or discomfort. The heart is unable to work properly. It may not be a disease. However, it can also be a sign of future problems in the arteries. If such a problem occurs regularly, there is a high chance of friction in the heart muscles. What are the causes of heart disease? In recent times, the number of people facing heart problems due to stress is increasing. Panic attacks are occurring due to stress, and some people are taking self-medication that is not suitable for panic attacks. There are also chances of heart problems due to taking these pills for some time and suddenly stopping them. Also, this problem is more common in those who consume excessive alcohol or caffeine. Low hemoglobin or anemia, thyrotoxicosis, excess thyroid hormones, and other common causes can also cause the problem. When to consult a doctor? Heart rate not only reveals your physical health, but also indicates stress, dehydration, and sleep quality. Chronic disturbances in heart rate can lead to serious illnesses. Consult a doctor if you feel dizzy, tired, or have chest pain. If your heart rate is less than 50 beats per minute at rest, consult your doctor. If your heart rate is more than 120 beats per minute during exercise or in a normal state and does not return to normal even after rest, consult a doctor. It is important to monitor your heart rate regularly. If you notice any abnormalities, consult a doctor immediately. It is possible to maintain a normal heart rate with a healthy lifestyle and regular exercise. How to take precautions? It is best to monitor using devices such as smartwatches or oximeters. If the problem seems severe, it is best to seek medical help. If you feel pain in the heart, an ECG is the best way to go. How to treat? Treatment is based on diagnosis. Stress, anxiety, and panic attacks that cause increased heart rate can be managed with counseling or sometimes short-term medication. Once diagnosed, heart rhythm arrhythmias can be managed with medication or, if necessary, radiofrequency ablation depending on the type.